We're all familiar with those pre-exam jitters, right? But when does that totally normal stress cross the line into something, well, more serious? In this explainer, we're going to break down that critical difference between everyday student anxiety and an actual clinical disorder.
I mean, that flutter in your stomach, that feeling of being on edge, it's pretty much a universal student experience. But have you ever stopped to wonder if what you're feeling is just normal stress, or maybe a sign of something bigger?
So, let's think of anxiety like your body's built-in alarm system. It's a biological response, and it's actually designed to help you handle challenges. When that alarm goes off, it triggers all these physical changes to get you ready for action. And for a short time, it can even boost your focus and motivation. So, in the right dose, it's not just normal, it's actually functional.
Okay, so if anxiety is just a normal alarm system, when does it become a problem? Let's really pinpoint that line in the sand between a feeling that helps you and a condition that hurts you.
And here's the real core of it. Normal anxiety, it's temporary, it's proportional to the situation, and it goes away once the stressful thing is over. A disorder, on the other hand, involves worry that's persistent, it's excessive, and this is the key. It starts to get in the way of your daily life. We're talking everything from your classes to your friendships.
So this brings us to the clinical side of things. How do professionals actually make it official? What are the specific criteria they use to diagnose an anxiety disorder?
Well, for a diagnosis of something like generalized anxiety disorder, or GAD, clinicians use a very specific checklist from the DSM-5, which is kind of the standard guide for mental health diagnoses. It's not just some vague feeling. The criteria are super specific: excessive worry for at least 6 months, real difficulty controlling it, plus at least 3 other symptoms. And most importantly, it has to be causing significant distress or impairment in your life.
Okay, with that clinical definition in our back pocket, let's look at the real world. How common is this really? And what are the practical everyday red flags we should all be watching for?
To put this all into perspective, just think about the high-stress world of medical school. Studies of students in New Delhi, for example, found that nearly a quarter of them reported significant anxiety. That just shows you how common this can be when the academic pressure is really on.
And get this, when researchers pulled together the data from a bunch of different studies, the number was even more stark: 54%. That's more than half the students they surveyed were experiencing anxiety. That's a staggering figure.
So what are the practical signs that normal stress is tipping over into a disorder? Well, it could be a really noticeable drop in grades, or feeling tired all the time, or withdrawing from friends, maybe even avoiding classes altogether. These are all signs of what's called functional impairment, which is where anxiety starts to actively get in the way of a student's life.
So if you see those red flags, what's next? Well, the good news is there's a practical toolkit that can help figure out how severe these symptoms actually are. A really common first step is a simple but pretty powerful questionnaire called the GAD-7. It's just a 7-question screening tool that helps put a number to the symptoms, which gives you a much clearer picture of what's really going on.
And the scoring is super straightforward. The final score you get on the GAD-7 places symptoms into these really clear categories, anything from minimal to severe. It provides a kind of objective snapshot that can help guide what to do next.
But here's the key number to watch for: 10. A score of 10 or higher doesn't automatically mean a diagnosis, let's be clear, but it is a strong signal that it's probably time to talk to a professional.
So this all fits into a pretty clear assessment approach. First, you have that initial screening, like the GAD-7. Second, you have to rule out any underlying medical conditions that could be causing the symptoms. Third, you figure out if a professional referral is needed. And always, and this is the most critical step, you do an immediate safety check for any risk of self-harm. Okay, we've covered a lot: biology, data, diagnostics. So after all that, what's the single most important thing to take away from this?
Ultimately, the difference between everyday worry and a clinical disorder, it really just comes down to these 3 things: severity, duration, and functional impact. So it's not if a student feels anxious, it's about how much they feel it, for how long, and how much it's affecting their life. And that leaves us with a final, really critical question. Knowing this line exists, how do we start building academic environments that address anxiety before it becomes a disorder? Because the real challenge isn't just about identifying the problem, it's about trying to prevent it in the first place.